Telehealth, a tough topic. It's really changed healthcare delivery, and we're going to start. Elliot.
Yes, hello everybody. Thank you again, and let's go to the next slide. We have had a number of discussions about telehealth going back to our ICG TMC meeting in Rome. We looked at the grand challenge of trying to integrate medical devices with the telehealth. Of course, by January, February, we're beginning to hear about this thing called coronavirus, and from March on, we were and are all deeply enmeshed in the battle with coronavirus. We have had numerous webinars about digital health and digital health updates, including the most recent one on cybersecurity. What has happened is that telehealth has exploded as a means of communicating with patients. Next slide, please. It's allowed our physicians to touch patients without the risk of infection. It's allowed physicians to have short, medium, and long consultations. Historically, we have had telemedicine going back into the 90s. I visited with Dean David at Texas Children's Hospital in the 90s and saw the wonderful telehealth programs he had that were going to, I think, Asia and the African continent, and also in the US, in Philadelphia, I witnessed the growth of India's teleradiology programs rapidly, and that's been a standard of care in the US for decades. However, when the pandemic hit and we realized that we couldn't have patients being visited by nurses or bringing them into offices to congregate together, all of our physicians around the world figured out ways to use tools like Zoom, FaceTime, whatever tools they had, frankly, and whatever tools the patient was comfortable using in order to have telehealth, teleconsultations. Next slide. There are innovations of all sorts that have been happening, physicians and patients at every age. One of the things that had stalled telehealth is we said, well, the elders, the seniors aren't able to use things like Zoom. Well, it turns out they had to use things like Zoom to see their grandkids. And everyone taught themselves how to use these tools. In the US, in Europe, in Asia, restrictions on use of telehealth went away. And we started using these tools for moment-to-moment, day-to-day, 7-day, 365 days a year patient care support. And new telemedical care programs emerged. Telecardiology and teleradiology were pretty well developed, but not at the level of day-to-day consultations, meeting with patients, teledentistry, dermatology. It's just amazing what has happened. You already heard our friend Dan Clark describe the pulse oximetry at home program, and in the US and the UK, this has proceeded to virtual hospitals, acute care in home, intensive care in home programs to keep patients out of the hospital. We're using this to try to keep patients safely at home, not having to come to the hospital for care that would perhaps be risky for them, and on the other hand, accelerating their journey home, giving them support and care while they recover, because we've learned that the recovery from coronavirus can take weeks and weeks, in some cases months and months. They don't need to be in a hospital. Those beds are needed, especially during surge and crisis conditions like we're all experiencing. Next slide, next slide. Over the horizon, there are incredible new things that are emerging in this. Nobody has sat still. Our clinical engineering colleagues have been working on device-to-device interoperability, device-to-EMR interoperability. You'll find standards at these links that have exciting new projects like this Madeira project, which provides for a combination of individual devices, semi-autonomous devices, and also closed loop, like blood pressure management devices, which is really provoked perhaps early by the military, but now we're looking at, well, what could we do to help care for patients in new innovative ways? Wearable sensors of all sorts, systems point of care tools, and then using machine language and AI, we're seeing example after example after example of using these kinds of tools to help nurses and physicians as force multipliers, and also to help individuals make their own decisions for themselves and their family. Clinical engineers are going to have a rapidly expanding portfolio. I mean, as Dan Clark mentioned, the profusion of pulse oximeters into the population. I've heard of this going on in India. This is going on throughout the US. is really a new horizon, new opportunity, and it's if there's any kind of silver lining to this crazy pandemic we have all gone through, is that telehealth has burst onto the scene and innovation is flourishing. Next slide. That's it for me. Please, if you have questions, ideas, these are ways to correspond. And back to you, Tom.
Wow, Elliot. I just wish you had more passion about that, brother. No, it's very cool energy, and because you're representing a very cool area.